Hello, my name is Brad Bengtson. You're at the Bengtson Center in Grand Rapids, Michigan, and I'd like to welcome you to our breast augmentation workshop. We're starting a series of different types of procedures, presentations, and in our workshop today, we're going to be covering what does the state-of-the-art breast augmentation look like, including some new implants that have just been FDA approved. So we'll walk you through what's new in breast augmentation, and thanks for coming. So when patients come in, they have a lot of preconceived ideas or notions about size. And so we've really come up with a couple things that are really super helpful. So I was just on a panel down at our national meeting in Austin, and people do breast augmentation and implant selection totally different than the way that I do it and the way we do it here, using their patient breasts dimensions and a couple different things we do differently. We've actually come up with a bra cup sizing system. So there is no standard bra cup size. Everybody's different. Victoria's Secrets are, they're more in the lingerie line now. They're not a bra cup sizing system or company. They're Optimus there, so you would be, if you're a B, you're a double D, there and stuff like that. So it gets people to the same starting point. So we'll measure the breast, the hemi-circumference of the breast, and I'll tell them what cup size they are based on our sizing system. So we're at the same starting point, because otherwise it's totally random, because a lot of patients will come in and say, I'm a B and I want to be a D, and I think they're a C, and so we have to get speaking the same language, because otherwise we're not on the same page. So bra cup sizing, getting a landmark size, and then about 200, 210 cc's is one bra cup. So it just gives a general range, and then we'll actually apply the patient's measurements, specific measurements from exam and their Vectra imaging. And then we can start putting different implants in to their image. And so it's awesome because, patients come in, they're not looking at other pictures of other patients, because everybody's breasts are different. And, it's hard to find someone whose breasts look like yours and then, have implants the size that you're looking for. It's just hard to match all those things up. So why not look at your breasts, what they could look like with certain size implants? So it's not perfect, two-dimensional, even rotational two-dimensional. It's not absolutely perfect, but it's the best that we have. We can ghost different implant sizes in, and what it causes with the cause and effect with different implant sizes and all that. So super helpful in drilling down on that. So the imaging simulation and helping patients navigate that whole selection process is really key. So some of the next processes, the nuances that we do differently than most plastic surgeons, I think, after implant selection, we get to the operating room, and we will give you some different medicines that will really help with decreasing some of the pain, non-narcotics. Most patients don't take narcotics post-op, or if they do, it's very minimal for just a day or two. And so that is all keyed up, though, with basically creating the perfect pocket for the implant size in surgery through a small incision in the folder crease, usually is an inch or less, right in the crease. We're basically creating a pocket perfectly to fit the implant without one drop of blood. And when you do that, there's no bleeding, so there's very minimal bruising, very minimal swelling, much less pain, much quicker recovery. So that's a key aspect that we do in surgery. We block the breast with Marcaine, a long-acting numbing medicine, all the way around the breast. We do rib blocks. We block the muscle a little bit. So all those things are key just to create kind of a post-operative pressure feeling. So it's like a woman will always say, if they've had babies, it's like my milk came in times whatever, 10, 100, whatever. For the first few hours, it's the worst, and then it just gets better and better. So the intraoperative, aspect of creating the pocket very precisely with no bleeding really sets up the procedure and the follow-up with less pain and those sorts of things. So precise pocket and bloodless surgery sets up a fast track recovery. So we actually have patients move their arms above their head, starting right in the recovery room. So they're kind of stretching and moving. Even with scaffolds, if we're using internal scaffolds, they can still stretch and move. So that's really important, because if you go home and don't move, you're going to get really stiff and sore. So really important to do that. And most patients, I let them lift immediately. Far be it for me to stand between a mom and her baby, so whatever you can lift easily, curls are not a problem. Within a week, you can do non-impact things, elliptical, stationary bike, walking for exercise and all that. And then at about a month, we kind of release patients to do more chest focus exercises or higher aerobic activity. The key thing to think about is we want to create this pocket, and the body forms a Ziploc bag around the implant called a capsule. And it's really important for that capsule to form and set up before you start putting a lot of pressure on the breast or being overactive with it, because it could stretch the pocket, and then we're back, a year later doing some sort of, correction. So we don't want to, push that and do that. So bloodless surgery, precise pocket leads to a fast track recovery. And then going on, to the other things I think we do really well differently. Intraoperatively, we also irrigate the pocket, sterilize the pocket, put the implant in with a funnel. All those things decrease the chance of extra scar tissue building up around the implant. I'll talk with you about the Motiva implant. Actually does that probably a little bit better of decreasing that extra scar tissue. So that's super important. And then the other thing, follow-up wise, that is super important is high resolution ultrasound. So as far as I know, we have the largest implant series in the world looking at breast implants inside the body with ultrasound. Been ultrasounding since 2004. We just presented last year and the year before on ultrasound in our series. We're 99.3% accurate on diagnosing a rupture of the implant. So follow up with breast implants with ultrasound, just an office-based procedure, is great, because patients will come a long way, and it's great to reassure them, hey, my implants are looking great and everything looks good. So it's very reassuring versus $3,000-$4,000 MRIs, or just randomly replacing implants and that. And then when we go through the implants too, they are increasing longevity. So we'll chat about that aspect too, but it is really important to know the status of the breast implants inside your body, right? So really important. So I do believe there is a state-of-the-art breast augmentation, and that's really what you get at the Bengtson Center. So there are things that we can do that preoperatively prepare a patient for, a great outcome. And then there are things intraoperatively that we do that a lot of practices don't do, that provide for better outcomes with fewer complications. And then there's certainly things that we do postoperatively that all rely on what we're doing before and in surgery too. It all kind of works together to get great outcomes with fewer complications. So the first of those is simulation and implant selection. So I think navigating the whole implant selection process is absolutely the most critical, aspect. Each part is super critical, but at the end of the day, a year later, when you have a great outcome and you don't have any complications or any problems, what you're looking at is the result of the selection of the implants you had, right? So we have to get the range right. And, a lot of surgeons still will just just tell me what you want. I'll go ahead and do that. Or my friend had, 400cc implants, so that's what I want. All those sorts of things. So there's a much better way to do that. And so we've been using Vectra simulation imaging since the beginning of my practice, actually. They've really helped us, and we've helped them kind of build this simulation system for breast surgery. And it's going to be even more important as we move forward and start thinking about augmenting different areas of the breast versus like an all or none thing. We need to almost get a topography of the breast as we move forward. But through what we call tissue-based planning principles, so we can put certain measurements of the breast, particularly the width of the breast, and then the stretchiness, like patient has had babies or not, just the compliance or elasticity of the breast, and then come up with a certain range that fits within their breast and their body. And then they have say in that range. So it's usually 100 to 150 cc's, variability. So it's a pretty broad range. You can really come up with a very wide variety of different implant widths and projections and stuff to get certain volumes. So involving the patient into that. So I always tell patients, I don't project onto you what I think you should have. Patients come in all the time and said, I didn't want to be this big, but this is what I got, sort of thing. So that should never be, right? So I'm just trying to figure out what the patient wants, and that's hard enough, right? It's really hard to kind of get into a patient's mind. But the navigation with the vector imaging and simulation is great because you can project up onto a big screen with a patient, show the patient all their breast asymmetries because, as we say, breasts are sisters, not twins. One of my mentors, Scott Spear, used to always talk about that. So we can really detail all those things, come up with a range of implants that kind of work in the patient's body, and really narrow that down and kind of get that down, because at the end of the day, that final implant selection is going to be really critical in setting patients' expectations. So, we spend a lot of time on the preoperative evaluation, measurements, simulation of patients. So yeah, we had a really interesting thing happen the other day. A patient came in for a breast augmentation consult and basically was asking for a yoga boob. And I was like, a yoga, what, yoga whatty? So it's really interesting, the, kind of the whole shift in breast size, procedures, those sorts of things, looking at outcomes. What's exciting for me is we have always lived there, right? So we've always been natural, proportional. The best plastic surgeries and patients can't tell have had it. And so it's very exciting to me to see the whole market shift back to smaller, more natural, implant sizes and that. And it's really also cool timing because technologies are kind of merging with the smaller breast approach. And there's going to be some new implants coming that are the next generation of the Motiva implant we're going to be sharing and talking about a little bit, that are really super interesting. They're going to be allowed to kind of augment almost areas of the breast instead of an all or none effect that we have today above or below the muscle, and with some new techniques and technologies that are coming. So I think everything is kind of merging to this new, breast idea. And, I always tell patients it's really a range that we're shooting for. There's not one perfect implant. But I think it is really cool that the whole market is kind of shifting back to more natural, proportional sizes. Initially, when I first started practice, my average implant size was probably 350, 380, something like that. And today it's probably at least 100 cc's less. So it's probably 280, 300, somewhere in that range. So there's still patients. I mean, you have someone who's 6'6", comes in as different than 4 foot, so different implants look different on different people, but there's definitely a huge shift to more natural proportion yoga boobs. So one of the next exciting, innovative things is a brand new breast implant. So this implant has been used in Europe, I think 5-6 million patients worldwide. It's very difficult to get new products into the FDA through the FDA in the United States, but it doesn't mean that it's a new implant. So this implant is widely used, particularly South America, Asia, and Europe. It has many different advantages that we're going to go through. I do tell patients it's not like Ford versus Ferrari. It's more like with the current state-of-the-art implant, they're both 6th generation devices. So it's really more Porsche versus Ferrari. So they have different, trade-offs, different benefits in that. But when you're talking about a smaller breast implant, more natural feel, softer, better skin envelope. So the nipple to fold distance, if that's shorter, the Motiva implant is, I think, a better choice. If you have a weight loss patient, if you're a weight loss patient, or you have a lot of extra skin, a lot of times you're using the scaffold anyway, but in those patients, to have a little bit of a capsule support is maybe advantageous or better. But this new implant, really cool. What I'm super excited about with Motiva is they're the only innovators in breast augmentation or breast implant technology. The space has been very stagnant for a very long time. It's been very consistent. The results have been good, but there's not been any really great new innovative products or techniques, technologies, that sort of thing. So that's one of the major things I'm excited about, the future, the current implant that they have, but also the future of breast augmentation and implants. The differences are, the first thing you'll notice is it's not a clear, smooth surface. It's kind of a velvety or silky sort of a surface. And some of the benefits from that are they're basically, when it goes inside the body forms a capsule around it. So they're fibroblasts that basically go and attach to the implant and form kind of a Ziploc bag. The best example is a Ziploc bag. It's crazy. It is about 1/10 of a millimeter thick and super strong. So just like a Ziploc. This shell surface, the fibroblasts don't really recognize, and they don't form as organized of a capsule around it. So it's very thin, and that results in a softer breast. Along with that, the implant themselves, the implant gel is softer, it's more compliant, and the shell is very stretchy. So the coolest thing, one of the coolest things about this device is it's very elastic. When I talk to different breast implant manufacturers over the last 25 years, trying to get them to innovate and develop a new implant, I would bring a 12-inch latex balloon, like at a birthday party, fill it full of water, so it's about the size of this, about the size of an orange. It's the perfect breast implant. It's crazy. You put it down on a surface, and it totally conforms to whatever surface it's on. So it doesn't stand up. There's no edge that you feel. You squeeze it, and it just kind of squeezes through your fingers and, goes back to just a normal, sort of appearance. It's very elastic, very stretchy. And so a saline or water in a latex balloon has the characteristics of the ideal breast implant. So what they've done is they've really captured those dynamics and put it into a long-lasting silicone shell, where the shell is stretchier, the gel is stretchier, And with that, with decreased scar tissue around the implant, all are going to lead to a much softer, more natural, sort of a feel to the breast. So those are some of the surfacey characteristics. Some of the other aspects, it does have an interesting barrier where if the shell does fail, there's a color that you see actually in the shell, and that basically shows you, hey, the shell is ruptured or there's something going on with the shell. We actually would diagnose that on ultrasound before surgery, but in surgery, it's going to be just an additive sort of a fact that, hey, yeah, there's definitely something going on. One of the cool things about the new 6th generation implant 2 is they're overfilled. Older implants were underfilled and they could rub on themselves like steel can cut steel, silicone can cut silicone. The new implants are overfilled, so there's really no way for it to impact on itself repetitively to damage the shell. So I tell patients, we don't know, we haven't really used them for this long, but the shell failure rate or rupture rate is going to be very low. I think the implants should last 20 to 30 years or longer. So it's great operating on younger patients now that you can't guarantee, right? There's no absolute guarantee, but very likely this implant is going to have much more longevity for you, push it way down the line before you need to actually have the implant replaced. So that's a huge, huge advantage as well. So these implants can be pushed in through a much smaller incision and basically be positioned in the body through that. So that's obviously an advantage. One of the last things that I would just say is it's very rare to have a high profile, person, actor, actress, high profile person actually come out and advocate specifically for a device. And Meghan Trainor, we love her Christmas album, by the way. So Meghan, if you're watching, we really listen to you all Christmas season long. And so she has really come out and is really talking about her experience with this implant and all the benefits that we've just covered. So one of her hit songs is "If I Were You, You'd Want to Be Me Too," right? So I guess that's true when it comes to this device. So at any rate, there are a lot of great reasons to consider the use of Motiva. At the Bengtson Center, we're going to show you all the devices that are available, talk with you about the trade-offs of the new implants, but we are very excited for this device for a lot of patients. So looking forward to having you come in and evaluate more and talk more about breast augmentation. So thank you for coming to our breast augmentation workshop. And Dr. Bengtson, really appreciate your time. We're going to have live Q&A now, so hop online and send us your questions. We'll be around to answer all of those as long as you have questions coming in. We'll answer all those. So thanks again for joining us tonight. Hello, everyone. Dr. Bengtson. Thanks for listening in. I listened to the whole thing as well. I'm sorry, I was just getting over a cold, and part of the voice was just a little bit quiet. So hopefully you got the gist of what we're talking about. And so we're here to answer any questions that you have about breast augmentation in general, or particularly the new Motiva implant. The first question is actually a really good question. So about 30% of the breast surgery I do is revision. I revise some of my own patients, but the majority of revisions are from other surgeons and just life, down the line. So the first question was, I had a breast augmentation in 2014. How do you know if you need your breast implants replaced or what the status is? So I've been really on the forefront, kind of the cutting edge, using high resolution ultrasound, looking at breast implants inside the body. And again, I think I mentioned in the discussion, we have over a 99% accuracy rate looking at the implant shell. So the first thing we do is have you come in, get as much information about the implant that you have, and then we'll ultrasound you. So I can tell you within a minute if the implants are intact or not. So if the implants are intact, you really don't have to have an implant replacement. Our approach is, if it's not broke, don't fix it. But, there's usually some other issues: extra scar tissue, malposition, the implants out of position a little bit, too far out or too far in, size change, breast, the breast changes over time, right? You have babies. And so, if we're going to do a mastopexy or breast lift in a patient with older implants, we're usually exchanging the implants, particularly with the newer ones, because they're going to last so long. So if you're happy with your implants though, and there are no other issues going on, we just recommend you have your implants screened or ultrasound about every 2 to 3 years, something like that. So fantastic question. So how far am I booked out for surgery and consults? I actually don't know. I show up every day and see what happens. So, but my schedulers you can call and can actually get a consultation as soon as possible. I have added a number of days, surgical days, as well as consult days. We can also do virtual consults. About probably 30% of our patients are beyond 200 miles of Grand Rapids. So we do a lot of virtual consults, just fast tracks and speeds up the whole process, and we can get you in a little bit faster. But I think during the summer, we're usually about 2 or 3 months out. I also have 2 great partners. So Dr. Alfonso, Dr. Horiat, one of our new associates, is amazing. So, we can definitely get you in if you have, a certain timeline that you're looking for. So, how do I know if I'm a good candidate for breast augmentation? So I think that mainly this is not a surgery that you need. I think talking to a plastic surgeon, it's a little bit surprising like that, but it's a surgery that you want, right? So if you have concerns about the shape or volume of the breast, then breast augmentation we can definitely do to enhance both of those. And I think with the Motiva device, what's crazy about it is we're getting to the point where we're going to be able to augment certain areas of the breast. So for instance, a lot of breasts there's a lot of fullness down low, or, I have plenty of breast tissue on the outside and you're kind of lacking volume in the upper inner part. And we can actually start augmenting specific areas of the breast. And the implant is so soft and has such a low scar tissue rate, then we can actually start, getting into shaping the breast much more accurately than we could, in the past. So I think those are a really good, potential, changes in that have been occurring. So potential scarring options, how visible will the scar be? So basically, we perform breast augmentation currently through an inframammary approach or a crease incision underneath the breast. We've done a lot of work with different implant companies figuring out the best volume and the best distance from the nipple to the fold. So once we determine the volume of the breast, and it's the volume of your natural breast plus the implant, then we can determine where on the breast or in the crease. I've seen a couple patients today in clinic that have minimal breast tissue, so they don't really have a well-defined fold. So it's really important to know where exactly the incision is going to be, because you want it hidden in the crease or fold. So you really have to lift up the breast to see it. The incisions are about 1 inch long and actually become a little bit smaller with the reinforcement we do in the fold with the sutures and stuff like that. So scarring is very minimal. Darker skin type 5, 6 patients have more predisposition to a little bit darker scars, hyperpigmented, that can hold on a little bit longer, but they're very, very small. And so that's the scarring on the outside. The scarring on the inside is super important as well. So as I mentioned in the video, the Motiva implant has this little textured outcome. And I just got back from Costa Rica visiting the manufacturing facility, which was absolutely incredible. And what's really cool about it is they have this kind of a fuzzy appearance on the surface. And the way they make the implant is they have kind of this mandibular form, and they just hand dip the silicone with multiple layers onto it. And then they actually take the implant and turn it inside out. So the surface that you see is a reflection of the texturing of this form or mandrel that's on the inside. And it's really important with these implants that it kind of confuses our body's defense system. So silicone is the most non-reactive substance known to man, and they've modified it even further so our bodies just don't form extra scar tissue around it. So it's very, very rare to have capsular contracture or extra scar tissue now. So recovery process. So this is changing. And in the past, when implants, I've always said when implants are perfect, there's no visible wrinkling and rippling, and there's minimal scar tissue, then I'll come up, and instead of putting implants partially behind the muscle, I'll come up into the subfascial or just underneath some of the fascial system. It's kind of, if you put a piece of chicken on the counter and you pull the fascia on the outside of it, the muscle kind of comes along with it. So there's a fascia over the muscle. So you can put the implant either below the muscle, partially below the muscle, or above the muscle. And if we go above the muscle, usually we go just beneath that fascia. So when implants become better and better, it's going to allow us to come from underneath the muscle to above the muscle. And it's a completely different scenario and stuff as far as pain, discomfort, recovery when it comes to that. But even below the muscle, you're really looking at a long weekend recovery. It's kind of a pressure feeling. You can lift immediately, kind of normal everyday activity immediately. And it just takes really a couple days to get through. But it's even going to be faster when we have the ability in the near future to actually augment the breast above the muscle, because this little kind of the wrinkling and rippling of the implant is not going to be as visible as if it's just underneath the breast. So it's we're excited for those changes. So anesthesia depends a little bit, again, on the position. So when we put implants today, there's a little bit of irregularity of the implant. We want to cover up the top of the implant where there's that irregularity. So if you see visible wrinkling and rippling, it's nearly impossible to fix. And so again, until the implants, and we're quickly getting to that point, when the implants become less visible, we'll be able to go just beneath the breast tissue and above the muscle. Then basically the anesthesia is going to change. So we use a general anesthetic today when we go underneath the muscle as well as above the muscle, just because when we're kind of lifting the fascia off of the muscle, it's going to be a little bit painful, and the muscles jump. So So we need to basically have a general anesthetic in that. The future may be different and just more sedation without a general anesthetic, but we're not quite there yet. So what's another question that we have here? So what type of follow-up care? So this has also dramatically changed. With older implants, say third, fourth generation implants, there was about a 1% to 2% rupture rate or shell failure rate per year. So the question earlier, 2014, so you have at least an 11%, some would say 20%, because you have two implants. The shell is potentially failed. It's usually silent. And so you can get a little mild capsular contraction with it, but most patients are walking around, they don't know they have a ruptured implant. So it's absolutely critical to go to a place that is very adept at ultrasound. So we really would recommend that you come in for older devices, that you come in, get ultrasounded, and then if the implants are intact and you're doing well, as we discussed earlier, then about every 2 years or so, we can just have you back, 2-3 years, have you back and just ultrasound the implant. So we see patients all the time, they just come in, talk about, how's your new house? How's your dog? How's your husband? Those sorts of things. And just as we're ultrasounding the breast, and there's incredible peace of mind to know and what the status of your devices are. So how do we determine over or under the muscle? That's a really good question. So the number is changing, and the over or under the muscle is going to change with Motiva. And so after coming, going down to Costa Rica and talking to the surgeons, the one surgeon, Manuel Chacon, I spent in his operating room yesterday. It was just an amazing guy. He has probably the largest implant experience with Motiva in the world. His father was a plastic surgeon, and his brother was the CEO of the company. So just unbelievable knowledge and experience and those sorts of things with the devices. So Motiva is going to allow us to go above the muscle more because the implant has such a low degree of scar tissue development around it and a low degree of visibility, palpability. But we like to, it used to be that people used to say 2 centimeters or an inch. If we can pinch the upper breast tissue and you have, at least an inch of thickness, then that should be enough to cover the implant and lessen the visibility of the implant. So that's really the main thing. Very thin patients, still, it's kind of above or below, their risk and trade-offs, their positive and negative things with above. But the tendency in the future is going to be going above the muscle, or at least beneath the fascia, but above the muscle, just beneath the breast tissue. Much less pain, quicker recovery, has a lot of advantages. So if I'm deciding to do surgery this summer, how long should I avoid lakes, oceans, and that? So I basically say about 2 weeks. So essentially the incision, we use some really cool sutures that have little barbs on them. They're all absorbable, but they kind of lock the skin together. It's really a really cool suture. And for all practical purposes, and we put a steri strip just on the skin. For all practical purposes, the skin is closed at that point. So from direct water, we don't recommend direct water pressure, but water running down, pat dry, it's going to be fine. We really need to make sure, though, that it's probably about 2 weeks or so. I had actually a lipoma or a fatty tumor taken out, and I hopped in a hot tub about a week, 10 days after surgery, and had a little opening. So obviously, if there's an implant in there, that's a problem. So my implants were fine. No, I'm just kidding. I don't have implants. So, but if that incision loosens or weakens, then it could be a little bit of an issue. So, so I just recommend about 2 weeks. Is there an absolute age limit that you would recommend breast implants or lift? So I personally, basically with the FDA has recommended age 22 for the use of a silicone gel breast implant. Saline you can still get. You can basically work around that and use an implant off-label, which basically we do off-label use every day in plastic surgery, putting Botox where it hasn't been studied, so it's not on label, but it does void the warranty. And so there's things to talk about, with that. Personally, I'm not a big saline implant fan. So if a younger person, I don't really operate on patients less than 18, but if you're less than 22, then you have the option of either going off label, which takes some additional consents, or waiting until you're 22. Those things may change over time as we get more, information in that. But I've operated on, patients in that age range. I think I've done an augmentation in ladies in their 70s, so or revisions and those sorts of things. Whether you need a lift or not, it's another discussion. But when you're standing or sitting and you put your finger underneath your breast in the fold where your breast attaches to your body, if the nipple is below that fold, then we need to lift it above the fold. And we can do that local with sedation, or, in combination with a breast implant that would require more of a general anesthetic. Let's see. I've been told I have dense breast tissue. So really the type of breast tissue that you have is not really a critical aspect to a breast implant today. So some surgeons would say that an implant beneath the muscle interferes with mammography less and those things, which probably is true, but it's really more important how much scar tissue there is. So the more scar tissue you have, the more it can obscure a mammogram. But we don't allow patients to walk around with capsular contracture or tight breasts. So it doesn't really matter too much. I tell patients, whatever your breast can do today, it can do after breast augmentation. So breastfeeding, imaging, activities, all those sorts of things. And I think the other thing that's really cool about the Motiva device, when they do a mammogram, as you know, they're displacing the implant or the breast tissue from the implant. And this breast implant is so compressible that, as you pinch the breast skin, it's going to kind of push the implant away. So unless you have a high density capsular contracture or extra scar tissue around the implant, excuse me, mammographers are going to be easily able to do a mammogram. They do an extra view just to make sure they don't miss anything, but it's not going to obscure any mammographic and certainly not any MRI issues at all. So that's a great question. The question about warranties, basically all implant companies will warranty a breast implant for life. So if there's shell problems, and most implant companies also have a capsular contraction reimbursement. So if you get extra scar tissue within the first 2 years, most companies have will give you a stipend towards the revision. So they all have very good warranties. I know that some companies have offered different, like if you pay extra, you can get an extended warranty, like if you go to Best Buy. I don't think current implant companies, at least that I use, are doing any additional fees. So they'll basically warranty your device for life. So one question about BII. So you'll have to kind of get online and look at BII more closely over time. BII is still very unknown. We're not really sure what exactly is going on with it. I personally believe, talking to two of my friends, female plastic surgeons who've done all the research in BI the last 15 years, what they're really showing is that every disease a woman can get is very close to the same in a woman with or without a silicone implant. And so there is the possibility that it might not be the silicone, but actually the body's reaction or the inflammatory response that the body has around the implant that actually causes some of the BII symptoms in that. So one of the coolest things about Motiva is it generates the least inflammatory response. So the body doesn't really recognize it as a foreign material as much as other devices. And so it's with that less inflammatory response, then I think that's the etiology of BII as it exists. And I think our understanding is going to change over time. But I have a little bit more confidence in this device with a decrease in inflammatory reaction. And more importantly, there's a rare lymphoma, BIALCL, that's been reported with a heavily textured implant. And we're no longer able to use those devices in the United States. But there's never been an ALCL case associated with a Motiva implant. So I think it just goes along with that decrease in risk. So let's see, how old is too old? So, again, I've operated on patients. I mean, the way I answer that is you can have a 90-year-old, 60-year-old, or a 60-year-old, 90-year-old, right? So it's really more your physiological age versus your chronological age. And I always tease, patients come in their 80s, sometimes in their 90s, that come in that we're ultrasounding their breasts. And I always tease them that, in all the local nursing homes, the most popular wing is the Bengtson wing, so, and we rarely take implants out. And so it's just really a pretty amazing thing. So if you're a younger, older patient, I mean, you don't have any heart problems, lung problems, bleeding disorders, different things like that, then to me, we always get medical clearance from your primary doctor. And if they say, yeah, I mean, she can have a general anesthetic, then, we're all for that. So 68 is not too old. So that's specific for that question. So I think that exhausts at least the questions that we have tonight so far. Definitely reach out. You can reach out to our clinical team. We can get you my email address as well. For any other questions that we didn't get to, we'll respond directly. I know we have some discounts for future consultations for patients that have attended the webinar. So feel free to really come in. The best thing to do is really come in for a consult or do a virtual, because everybody's a little bit different, and we need to spend probably about an hour total, and then just going through very specifically your individual goals and those sorts of things. And there are things that we can do a little bit online and with photos, but we really need to see you, face to face and walk through, the procedure in detail, specifically for you, I think, to get the best outcome. So screening, just the last question here just came over. How much is ultrasound screening? I don't charge for ultrasound screening. So regardless if you've had your breast implants here or anywhere else, happy to see you. And if that's all you'd like to do, come in and screen, I'd be happy to do that. Do an ultrasound. Just takes 5 minutes, and we'd love to meet you. So, but thank you so much again for attending. It was great being with everyone. Hope to see you here at the Bengtson Center.